RC710. This male's been kicked in the face by a horse.
Oh.
A young horse trainer has been seriously hurt at a stable in Melbourne's outer southeast.
Hold with conscious Dave, code 1, thanks.
At Victoria's Emergency Communications Centre, call takers are still speaking with the man's worried workmates.
Is there any serious bleeding?
Yeah, he's lost a bit of blood. I can follow the trail of blood. He's walked.
Okay. Is he unconscious at the moment?
He's just lost consciousness. He's in and out real bad.
Okay.
RC710, this case has been upgraded to a priority 0 patient now unconscious.
Boom, boom.
30 received.
An ambulance crew has just arrived on the scene and is requesting help from the intensive care team.
So significant blunt force to his face, query jaw, query nose, lots of blood, altered conscious state. So it sounds like some decent facial trauma.
At 30, we've arrived.
Want to go to the other ambulance where exactly it is?
Absolutely, mate. Yeah.
I'll run and you follow me? Right around the other side of the
No
bar.
dramas.
It's quite a big horse complex and there's driveways going in every direction, so a young man runs along in front of the ambulance and guides us.
That's all you need. They've got a monitor. Yep, I've got everything else. There you go, mate.
What's this gentleman's name?
Nathan. Yeah.
Nathan, my name's Karina and this is Paul. His brain's been shaken around. There's a possibility he's got bruising or bleeding, and also he might have a spinal injury. It's very clear that he's really uncomfortable. He's in a lot of pain.
In the city centre, things are also getting a little tense for regular partners Taz and Amanda.
Taz, seriously, enough. Enough.
This chewing gum.
Yeah, it's not the chewing gum, because 30 seconds after we got in the car, when you had no chewing gum, you started burping.
The best part about this job is the fact that you form relationships very quickly with your partner. But this man sitting beside me is just winding me up. So I just laugh it off and let it happen.
I don't think I can roll my eyes any louder. All right, Taz, we've been dispatched code 2 to a female with a pre-existing leg injury. Pressured to speak to AB, patient became verbally agitated.
The call for help has come from Melbourne's busy Southern Cross station. As the 65-year-old woman is so agitated, Protective Services officers have been brought in.
Hello?
Can you please just take me to the refuge?
A refuge?
Yeah, I can't go back home.
Where is home?
I'm not going back there.
Okay, that's fine. That's fine.
Amanda's first challenge is to work out what's wrong with the patient.
My carer put a curse on my legs. They're both swelling up now.
How long have you had the swelling in the legs
I
for?
can't remember, but my carer wants to cut my feet off, cut my knees off, cut my legs off.
Okay.
Okay?
So the initial complaints come through as leg pain, and they do look red and painful. I look at her and I think she's small, she's frail. It just really makes your heart go out to her. But clearly there's some type of psychiatric issue.
My carer, he rips my heart out.
A lot of questioning obviously needs to be done in order to get an idea of what's going on.
You're right.
Back in the outer suburbs, Karina and Dodsey are with 31-year-old Nathan, who's been kicked in the face by a horse.
Any medical past history for him? No diabetes, no asthma, not any permanent medications for anything. Is he allergic to anything?
Not at all.
No worries. When I first see Nathan, he's done quite a bit of damage to his face. Superficially, it looks bad, but you can never quite tell what's going on, you know, under the skin. I notice one of your eyes isn't opening as well as the other one.
Okay.
Is it sore under this eye?
Yeah, listen.
I'm going to pop a drip in your arm. I'm going to give you something for the pain.
Stables owner Ted hasn't left Nathan's side. He knows just how dangerous working with animals can be.
Well, they're only baby horses. You've got to be very, very careful with what you do. They haven't been handled a lot and they're, pretty flighty. So you've been kicked in the face, so that can be fatal.
Give that pain a number out of 10, mate.
I can tell you.
Let's just get some pain relief on board first. That's all right. You're right, mate.
As soon as Nathan's pain is under control, the team must get him to hospital urgently. Otherwise, his injuries could become life-threatening.
His jaw is clearly fractured and dislocated. His face is smashed in. He's already got airway swelling, and I'm concerned that it will close over and he won't be able to breathe.
Oh.
We're just going to put some morphine on board now, okay?
Teddy!
You what, mate?
Teddy!
What? The baby's got to be fed, do they?
No, hey.
Hey, no worries.
Hey. We'll give him hay, mate. We'll give him hay. Oh.
We'll fix him up, don't you worry about it.
All Nathan is worried about at the moment is making sure that his horses are fed. I don't think he understands how serious his injuries actually are. If Nathan's airway closes over and he becomes unconscious, we'd have to make an incision in his neck and put a breathing tube in it. And that can be really complicated.
My carer, he rips my heart out.
At Melbourne's Southern Cross Station, Amanda and Taz are trying to help a 65-year-old woman.
Can I take your blood sugar?
Please take this thing off.
Because she's so agitated, protective services are also on the scene.
Do you suffer from any mental health issues?
No.
You don't. Do you take do you take any medication for mental health at all?
No.
Okay. All right. Look, I think the best thing for you at the moment is to take you up to the local hospital up here and get you seen by someone who can help you out.
Every year, Victoria's paramedics are called to thousands of suspected mental health cases.
Take this up. That's it.
Amanda and Taz know these situations can quickly become volatile.
Can I get you to hold that as well? Yeah, I'm going to put a blanket on you in the back of the ambulance, okay?
In our job, we often go to mental health crisis. But in this case, it was very sad to see a very fragile-looking lady stranded at a railway station.
I'm so cold.
Is that warmer? I'll even give you a sheet so that you're
I don't need a sheet. That's hot enough.
But at the same time, I noticed that she's displaying the sign of some verbal aggression towards Amanda.
Get me up there.
Look, you just need to be a bit patient, okay? Just relax. Just relax. We're here to help you, okay?
She's a very difficult patient to assess. She's really fidgety and agitated and I can't seem to settle her.
Put the air on, please.
Are you cold or hot?
No, it's too hot in here now.
All right.
Taz and Amanda can only safely set off for hospital if the woman is calm. But she's becoming increasingly aggressive.
Put the air on, it's too hot in here, please. Please.
Just relax.
We can't open up the back doors.
The back doors are staying closed.
Normally, I can get a bit of a rapport and I can get people on side, but she starts to get very vocal, very loud, and she really doesn't want to be there.
Open up the back doors.
The back doors are staying closed.
Please open up the back doors. I'm having a heart attack.
There's a bed just to your right. If you spin around, you'll feel it against your bum. Perfect.
Karina and Dodsey are preparing to take severely injured trainer Nathan to hospital after he was kicked in the face by a horse.
Good job, mate.
His swollen airways could quickly become life-threatening. But that's not all the team are worried about.
It's hurt his back.
Hurts your face?
Obviously, being kicked in the head by a horse comes along with a significant risk of spinal injury. So ideally, I would put a collar on Nathan.
When he goes back.
But he's got swelling, and if somehow that pressure of the collar moves his jaw and compromises his airway, then we're really in trouble.
That's cool. It's all cool. It's all good.
Nate, do you want me to come to the hospital? Nate, it's Mum. Do you want me to come to the hospital?
Nathan's mum, Jenny, raced to the scene as soon as she heard about the accident.
God, you worry me.
Just kick him up.
You know that? But I knew I had to be strong for Nathan. I was making sure that no tears dropped. No tears. I wanted to grab him and hug him, but I knew I couldn't.
It's already been a long, emotional day for Jenny, having earlier received some happier news from Nathan and his partner, Michelle.
Oh, no, man. We're going to give you some more pain relief, all right?
He rang me at work and said, oh, Mum. And I went, oh, no. And he went, we're having twins. Nathan was over the moon, and it was good news, but it then turned pretty bad.
If I touch this side of your jaw back here, it's not sore. It is when I get lower there, is it? Okay. Once we get Nathan in the back of the car, the process is about assessing his conscious state. So we need to make sure that the swelling around his airway doesn't get any worse.
The journey to the Alfred Hospital's trauma centre in Melbourne can take over half an hour.
Just a little cruisy on those bumps if we can. Thanks, Jazz.
And Nathan's condition could rapidly deteriorate.
For me, it's not just about the injuries you can see, it's about the injuries that you possibly can't see. You need to take into consideration that, he might have a brain injury. So we just really need to watch Nathan like a hawk.
Open up the back door!
The back doors are staying closed.
Back in the city, Amanda is still trying to calm her elderly patient.
If there's any safety concern, Amanda, there's always an option.
I think we'll be all right.
Due to the woman's suspected mental health issues, Taz is keeping a close eye on the situation.
Just put the air on, it's too hot in here.
The air is on, okay?
Please put it on,
and I am not going to deal with you yelling, okay? We're not going to yell. Just relax. Just go, just go.
You can never lose your guard in this job at any point. Doesn't matter the patient is fragile or they're old. You never know, next move can be hitting Amanda.
I don't want a needle.
I'm not giving you anything. The only reason that I would have to give you something is if you get angry and aggressive. And that's not going to happen, is it?
You please do CPR on me because I'm having a heart attack.
You're not having a heart attack.
Yes, I am. I'm talking too much.
You're not having a heart attack,
Please,
believe me.
Padding's in here. Please do CPR on me.
I assure you, you do not need CPR, okay? She's convinced herself she's having a heart attack. I try my darndest to calm her down and assure her she's talking to me, therefore she doesn't need CPR. And everything that I can see is checking out okay.
Put me down flat.
You want to lie down flat?
All the way flat.
Okay, just standing. So for a minute, I thought I had her under control. No.
In the air.
No.
I do it. I got my legs up in the air.
You do not.
I do so.
Then she came back with a vengeance.
Amanda, I gotta do it.
No, you don't.
I'm doing the bound.
Do you want to pull over?
What's the matter with you?
Enough. Enough.
You stop it.
Lie down.
Leave me alone.
Enough. Enough.
Let go.
Enough.
So in this job, always expect the unexpected.
You are safe. We are here to look after you.
This patient snapped and became aggressive and a potential to harm herself and maybe a potential to harm Amanda also.
Enough.
And at that stage, I think I have to step in.
Stop it.
No, you have to behave.
Just
okay?
relax,
This is the
darling.
first and final time I'm telling you.
Usually I don't raise my voice, but in this case, I think that it was vital for me to escalate in a verbal tone to de-escalate this situation.
We are helping you. We're taking you to hospital.
Get me out of here.
All right. We'll be behaving now.
Taz, sit there. Relax. Obviously, with this job, every day is a school day, and I'm very much still learning and still being exposed to all different types of cases. For me, I would just go in soft and calm and try and calm the person down, but escalating to de-escalate, I'm putting that in the bank.
Team manager Phil has been called in to drive the ambulance, while Taz helps Amanda manage her unpredictable patient.
My partner is being so patient with you, trying to help you, and you're showing some silly behavior.
This job was a great learning curve for everyone. Sometimes you have to improvise for the greater good of the patients. I really hope that this lady gets some kind of help and support so she doesn't have to go through this kind of crisis again.
Just a few bumps coming out here, guys.
Thanks, mate.
Karina and Dodsey are now on their way to hospital with 31-year-old Nathan after he was kicked in the head by a horse.
Now, that clearly that pain in your face was a 10 out of 10 before. What number is it now? You can show me with your fingers. It's about a 5 now.
Nathan's mum, Jenny, is travelling with them.
Nathan worries me because he loves horses so much. He's dedicated and he shows no fear.
I'm just going to check your blood sugar, mate.
He won't stop it because his life could be at risk or how dangerous it is, where it could leave him permanently maimed. It's Nathan. But yeah, it does worry me. It worries me greatly.
Jenny?
Yeah?
Just letting you know he's travelling okay at the moment. He's reasonably comfortable. We've got a fair bit of morphine on board. We're not going to put a collar on because his jaw is displaced.
Yep.
Our other concern is he may have fractured through his cheekbones because one eye's quite swollen.
Hey, mate, you didn't even see it coming.
Bit of force behind the hoof.
Nathan's day certainly began on a brighter note.
That morning, Nathan and his partner had discovered that they were having twins, so it's unfortunate that the happiest day of your life suddenly turns into a disaster.
Karina.
Yeah.
Emergency teams will now assess the damage to Nathan's airways, fractures to his face, and check for any life-threatening internal injuries. He has a long recovery ahead.
Seemed like a really decent young bloke.
Yeah, it's good that he had 5 million people around. I mean, I know it was a cast of thousands, but if he'd have been out there on his own...
And that could have been interesting as well. So I think he had plenty of support there, which probably helped him a little bit.
Yeah, they just seem like good, honest, everyday people.
Stay calm for me, okay? We're going to get your son some help, but I need you to listen very carefully. You need to tell me exactly what happened.
Thousands of calls for help come into the Emergency Communication Centre every day.
Does she have difficulty speaking between breaths?
With ambulance services under pressure, non-critical cases are diverted to an emergency medical specialist.
So the symptoms your daughter is displaying today are not life-threatening, and I can see that you're quite close to hospital. Are you able to get her in the car?
Now, he's going to be okay. He's cut his finger, but it's no longer bleeding.
Now, I think, Jack, based on the symptoms that you said, I don't think we need to take you to the hospital today.
But there are hundreds more life-threatening cases requiring urgent attention.
Emergency services.
We had a paraglider pilot flying and he's crashed at 30 to 40 kilometres per hour into the side of the hill.
Yeah.
He's in a lot of pain and we're not sure whether...
Yeah, do not move him at all unless absolutely necessary.
The paraglider has come down in a remote location and flight paramedic Matt is being dispatched to the crash site, 120 kilometres northeast of Melbourne.
Medivac, BFR AW139, air ambulance, we request taxi and airways. 1628, airborne. Roger. So we're going to a paraglider, which sounds like he's come to grief into a tree. I don't know what injuries he has at this stage, but he's in a very awkward position, reportedly.
Emergency teams on the ground have hiked through difficult terrain to reach the crash site and are urgently requesting assistance.
Door open and locked. Roger. Yeah, probably not really anywhere to land in there.
But if Matt's to get to the injured patient quickly, he will have to go in by winch.
Yeah, I think the patient's out here till 11 o'clock, mate. Yeah. Oh, that's them there. Yeah, got them sorted. Yep.
When we look around the area, we can see that the patient is stuck on the crest of a hill.
All right, we need to go stage somewhere and then plan from there, I think.
We weigh up all the factors as to whether it's going to be a reasonably safe area to winch into. It's big decisions. We don't take it lightly at all. But this really needs to be done, otherwise we're going to ultimately delay the delivery of care to the patient.
Only a handful of winch jobs are undertaken each year in Victoria. They are inherently risky and are only attempted when it's absolutely necessary.
3, 2, 1, wheels on. Roger.
But before they can begin, the helicopter must shed weight by offloading one of the crew.
The lighter they are, the better they perform. We just want the aircraft to be at its best possible functioning capability, so we take off all the things that we don't actually need to be on there, and it improves the performance.
Righto, let's get up there.
As they prepare for the winch, the team also searches for a safe landing site nearby.
Here's the spot coming up now at our 1:30, 2 o'clock. So that's where we were looking to maybe for an extraction zone. You've got heaps of SES down there. We might be able to walk it out. Yeah, might be the preferable option.
The patient's location will be much harder to reach 100 metres below through a thick canopy of trees.
I've never really been very good with heights. Dangling there in the air, and you've got this mechanical machine that lowers you down on this cable, and then you look up and you're looking up at a big tin can which has got a fan on the top which is spinning around.
Helmet's good, chest, and all the way down is all good. Thumbs up off Chef. Chef's coming out of seatbelt.
It's a really unnatural procedure to actually be doing. It's a dangerous, daunting experience.
And bring your Chef across to the door. I'm ready to winch.
It's been a massive year for you.
Huge.
So much has happened.
Yep. Got married. Now I'm expecting my first child, believe it or not.
How exciting.
In Melbourne's southeastern suburbs, Nat is catching up on Leonard's news of his recent marriage to his long-term girlfriend, Larissa.
And you didn't take my advice, which was to run.
No.
Yeah.
She's the one.
She's the one, isn't she?
The one.
Yeah.
So the wedding day for me and Larissa was absolutely perfect. We got married on Hamilton Island and it was just magical.
The perfect woman.
Pretty much, yeah. I don't want to get too mushy. Don't make me cry.
No, I won't make you cry. You do that yourself, so.
I don't know what happened. All of a sudden, life just changed in an instant. Took me 10 years to actually propose, only 6 months to get married, and a couple of weeks to actually get pregnant. Well, my wife to get pregnant. I'm excited now,
Oh, it's amazing.
I think it is probably a good time for me, as scary as it is, and as much as I thought, nah, I'm not gonna ever be a dad.
You're gonna love it, Leonard.
I truly think Leonard will be a brilliant father. I think where he might struggle is that he's super organised, he likes to plan everything, throw a baby into the mix and he is not going to know what has hit him. You cannot plan anything with a baby. Yeah, good luck, Leonard.
Oh, hello. Harvest Ped.
But Leonard's baby skills might be tested sooner than they think.
715%.
A worried young mother is in need of help.
What's happened there?
So we've had a car who ran through the crossing and hit the pram.
So it's car versus pedestrian, and the vehicle tipped the pram?
Yeah.
So baby's been tipped over.
The pram's been tipped over.
With baby in it, I can only suspect. Information is rolling in saying that the pedestrian's actually a baby in a pram, and I'm thinking the worst case scenario.
The thought that something could have happened to this poor baby is scary. We're going to have potentially an injured baby. We're going to have a very distressed mother. It could be a really chaotic scene.
It's here.
Carrying out my secondary checks on Shep. Second checks are good. And bringing Shep across to the door. I'm ready to winch.
In remote bushland, Matt is about to make a difficult descent to reach an injured paraglider who crashed into a tree and plunged 45 metres to the ground.
Aircraft's well clear. You happy, Shep? Yeah. Telling Shep he's going down. Roger.
It is always a very daunting experience.
Winch down.
Being there in your harness, attached to the cable, entering out the side of an aircraft, and then letting go.
And you clear up 5, go up 5. Up 4, up 3, 2, 1, hold. High positions, good maintain.
The communication that goes on inside the aircraft during a winching procedure is huge.
So the chap's approaching the deck this time. He's 15 feet. You're moving forward and right. Stop drifting forward and right. 5 feet off the ground. 4, 3, 2, 1. And chap's on the deck. Right, chap's disconnecting from winch hook. Recovering an empty winch hook. Nice work, Scotty.
While Matt makes his way to the patient, the crew heads to their landing site.
All right, so there's our spot just over there.
But with the thick tree line, this is also a tricky descent.
Vehicle tipped the child's pram that a female is pushing. It's essentially a car versus a pram.
It's just here.
Nat and Leonard have arrived at a hit and run involving a baby.
Hello. That's all right. My name's Leonard. What's your name?
I'm Kirsty.
Do you want to tell me what's happened?
I was crossing the crossing here. This car's come flying around the corner. He's hit the side of my pram, and then I went to go talk to him, and as I'm talking to him, I'm trying to open the door because he was about to drive off, and he just
took off.
He took off.
He panicked and then just left.
And there was a gentleman that just come by. He's got a Dashcam video.
The in-car footage shows baby Cooper being hit on the pedestrian crossing.
How old's Bub?
Bub's only just turned 10 weeks.
10 weeks.
He was born 10 weeks early.
It's an extremely bizarre situation. Here I have Mum telling me that this pram has been hit by a car and the baby was in it. Rather than stopping to assist, he drives off. I'm completely shocked. I mean, how could anyone leave the scene of an accident, let alone when a baby's involved? Obviously, I'm concerned at any time a car has hit a pram. Premature babies are particularly vulnerable, especially in car accidents, so it's all the more important for us to make sure that he's 100% okay. So what I'll do is I'll grab some of my equipment, I'll bring it out here, we'll keep Bub inside the capsule. Are you okay as well?
Yeah, I'm just a bit shaky.
Just a bit shooken up? Assessing a baby is extremely difficult. Cooper's actually still sleeping. To me, that's a reassuring thing, but it's also important that I determine that he's actually not unconscious.
Maintail's clear down, forward right, behind and below. Roger.
120 kilometres from Melbourne, Air Ambulance HEMS 1 is landing near the scene of a paragliding accident.
Wheels are holding nicely, mate. Front's got about half an inch. Front's on. We're down.
Just back up a bit. All right.
There you go. Now turn around towards the stretcher.
With the help of ground crews, Matt has treated the patient's injuries and is now preparing to airlift him to safety.
Strap you in.
He's very lucky. You think about it, he's been flying up in the air on essentially a kite, lost control and he's gone down into a tree. And from what I can see at this stage, he's got a nasty injured arm.
Originally from Brazil, 35-year-old Carlos has been paragliding for 2 years. This morning, wife Giselle recorded him take off on his fateful flight.
Woohoo! After he launched, was like, okay, the weather was okay. And I saw that he started to drop so fast. This is not normal.
Wonderful. Excellent.
One of our friends was with me. He said, I don't think he's okay because he fell from the sky. He just dropped like a stone.
After crashing into a tree, Carlos fell 45 metres through branches to the ground.
Carlos, my name's Matt. Hey, Matt. I'm going to travel with you back to Melbourne. We're going to take you to the Alfred Hospital. You've still got a bit of pain there, I believe. Yes, I'm going to give you a medicine into this little drip that they put in. Just going to have a look at it, make sure it's all working nicely.
Given the mechanism of the incident that Carlos has had, he's lucky he didn't have a tree branch go into his chest. If he had have had his arm up in a different position, he's lucky he didn't bang his head on anything. You know, he is lucky to have survived this accident.
You guys have a really good job. Be flying all day long.
It's a bit safer than paragliding.
Yeah, I assume so.
Matt is still worried about just how much damage has been done to Carlos's arm.
You get a large amount of swelling that goes on in those areas after those types of accidents. And if that pressure continues to go and the circulation stops, you know, that threatens his limb effectively. So he could end up actually losing his arm from it.
Hello? I don't want to disturb you. We want to make sure you're all right.
Back in Melbourne, Leonard is examining 10-week-old baby Cooper for any injuries after his pram was hit by a car.
There he goes. He's trying to fight me off. Sorry, Bubba. I'm woken you up. Testing out your strength.
He's pretty strong.
He is. So heart rate 152, sats of 97.
So far, the assessment suggests Cooper has escaped unscathed.
Numbers only paint so much of a story, and for little ones, particularly ones that don't talk, it absolutely doesn't paint the whole picture. So I'll be very heavily guided by you.
Yeah.
So to you, is Cooper, obviously being so young, but is he
He seems to be fine.
exactly normal? Colour is normal? Yep.
Sounds good.
When attending to a little child or baby, it's always a nerve-wracking experience. But for me personally, being an up-and-coming father, I felt a little bit more anxious than normal.
You're going to have one of those soon.
I know.
Are you ready for it?
No. Definitely not.
To be honest, I don't think having a child was in my 1-year plan, and it was borderline on the 5-year plan. So, look, I'm excited, but I'm freaked out, to be honest.
Oh, lucky kid, wasn't he?
How lucky?
It was like he was cushioned with all those, you know, in that capsule that he was in.
That was a good pram. It had all the side curtain airbag type things you could ever hope for. But luckily for Cooper, he had no idea.
Slept through the whole thing. I know.
No idea.
I hope your baby sleeps like that. Just sleeps and sleeps.
I hope so. I'm not going to be able to go to work otherwise.
My kids did not.
Carlos, can you hear me? How's the pain in your arm now? Is it getting better?
Matt is on the way to the Alfred Hospital with crash-landed paraglider Carlos. His injuries are so serious, he could end up losing his left arm.
I've given you some medicine which is going to make you feel quite sleepy and quite drowsy and quite strange. But we should get on top of your pain in a moment, okay?
Carlos is in considerable pain, so I've just got to try and give him as much analgesia as I can to make sure he's comfortable on the way back to hospital.
Carlos, big breaths, big breaths. Big breaths. Good man, that's it.
So far, this rescue has been a logistical challenge.
Ambulance, HEMS 1.
But it's not over yet.
HEMS 1 receiving, go ahead. HEMS 1, you're going to have to land at Essendon as well as clear out of the Alfred or open patch in time. HEMS 1 received, no worries. We will go to Essendon, and obviously you'll need to organise a car for us.
The team is being diverted to the air ambulance base, where Carlos's journey to hospital will continue by road.
You all right, Carlos?
So it's unfortunate for Carlos. He gets the slower trip to hospital. But I'm sure that when he gets to hospital, they're going to take good care of him, give him all the scans, and ultimately he's probably going to end up needing surgery.
As the ambulance leaves the airfield, hospital staff are on standby for the emergency surgery Carlos may need to save his arm.
Yeah, the swelling's come down a lot. Yeah.
It's healing well.
Shake. Come on. Good girl.
Horse trainer Nathan is now back at home with his pregnant partner Michelle.
You get that pain a number out of 10, mate?
I could tell you.
Let's just get some pain relief on board first.
The 31-year-old spent 2 weeks in hospital after being kicked in the face by a horse.
Oh. Yeah, so we're nearly on 8 weeks now since the operation. The extent of the injuries was broken nose, shattered cheekbone, broken eye socket, and then obviously I think I had 25 stitches all up through in and out the mouth, yeah. And inserted 5 plates all the way around my face, down through the nose, or like the nasal passage and down through the cheekbone to repair it all. So how many weeks now is it?
15.
20 weeks to go.
Yeah, roundabout, yep.
Couple little bundles of joy. Exciting times.
With twins on the way, Nathan is back working as a roof tiler. But is he going to continue training horses?
He came out of the induced coma and I spoke to him and said, you know, we'll get some horses moved, and Nathan gave me a look that I probably would never want him to look at me like that again. It was as if to say, don't even keep talking. His actual words were, I've got a broken nose, not broken legs.
Filling my shoes up with sand, Bruce.
I would love it if Nathan was to cease working with the horses, but he wouldn't do that. That's his love. That's what he gets up to do every morning.
Good man. Yeah, I'm very passionate about the horses. I work 2 jobs to be able to do what I love and chase the dream of being able to continue to train horses. I never thought about quitting. You know, I'll be going out on my own terms, not from a kick to there, that's for sure. Oh boy. Good boy, Bruce.
Also doing well is baby Cooper. His pram was hit by a car on a pedestrian crossing, but the 10-week-old is showing no signs of injury. Police have now identified the hit-and-run driver and charges have been laid.
I got the patient visual 8 o'clock, mate. Nowhere to land.
And it's been 3 weeks since paraglider Carlos crashed into a tree with his horrified wife looking on. He was emergency airlifted back to Melbourne and had surgery on his arm.
When you move, you don't feel pain in the
No,
middle?
it's
the
still
elbow?
very painful, and it's just annoying sometimes when I walk, when I stand up. My movement, it's quite limited like that.
Carlos didn't lose his arm, but it was fractured in multiple places.
I broke my bone from the wrist to the elbow, and I broke also the little bone on the elbow, the disc bone, in 5 pieces. It's something that I don't want to repeat in our lives. That's why I'm seriously considering not go back to fly.
Carlos's mobility will be limited for a long time to come. But there is hope he will eventually make a full recovery.
In my opinion, I think Carlos, he's gonna fly again, but not now. I think he needs time, and he can fly again. And no more nights in the hospital, right?
Yes.